Hi, my name is Marisol Oviedo. I'm an environmental health specialist with the Yakima Health District. In response to the current COVID-19 pandemic, the Yakima Health District has developed educational material to help all of our local businesses protect their workers. I'll be talking to you today about how to prevent worker exposure to COVID-19 in agriculture-related industries, which include packing houses, food processing plants, and outdoor fieldwork. We know that in an emergency, not all businesses can close, as some are needed for essential functions. For businesses performing essential functions, such as packing houses, food processing plants, and outdoor agriculture activities, we urge you to follow these recommendations to ensure the safety of your workforce and therefore the continuity of your operations. Coronavirus, or COVID-19, is a serious workplace hazard that can be spread from one person to another when an infected person coughs or sneezes. Coronavirus can be transmitted when a person touches a contaminated surface or object and then touches his own mouth, nose, or eyes. Under the Department of Labor and Industry rules, employers are required to provide a safe and healthy workplace and implement the governor's proclamation to prevent coronavirus transmission. To protect workers from coronavirus, employers are required to maintain social distancing, keep workers at least 6 feet apart, ensure adequate hand washing facilities and frequent employee hand washing, increase regular cleaning and sanitation of common touch surfaces, making sure sick employees stay home or are isolated or go home, and that there are procedures for workers to respond a suspected or confirmed coronavirus case, and educate your workers in the language they understand best about coronavirus and how to prevent transmission. It is against the law for any employer to take any adverse actions such as firing, demoting, or otherwise retaliating against a worker they suspect of exercising safety and health rights, such as raising safety and health concerns to their employer, participating in union activities concerning safety and health matters, filing a safety and health complaint, or participating in an L&I Division of Occupational Safety and Health investigation, DOSH. Workers have 30 days to file a complaint with DOSH and or with the Federal Occupational Safety and Health Administration, OSHA. Employers are required to implement an effective social distancing plan. Employers must ensure all employees keep at least 6 feet away from coworkers and the public when at all possible. Suggestions to achieve social distancing of 6 feet in agriculture work includes stagger tasks and work shifts so workers do not crowd. Limit work to only necessary tasks and organize work to allow for 6-foot distancing. Out in the field, assign and enforce tasks to maintain a distance of at least 6 feet between people. On production lines, reduce occupied like task worker stations and slow production pace. Temporarily mark 6-foot increments using adhesive colored tape on the ground or processing floor to ensure social distancing. Reorganize work and break up tasks to facilitate social distancing. Consider shifting the location of workers and tools used. Provide two-way radios for workers to communicate without having to come together. Set up staging areas where tools or other materials can be dropped off and picked up by workers. Find alternative to group meetings for sharing information, such as telephone conferencing. Hold meetings, breaks, lunches, and other gatherings outdoors or in a large enough area to maintain 6-foot distancing. Establish physical distance monitors to reinforce the minimum 6-foot separation. Consider reducing the size or weight of the material being worked, lifted, or processed to accommodate 1 instead of 2 workers for that task. Review jobs normally done by more than 1 person to see if 1 person can do them. Prohibit carpooling when the passenger space in vans and trucks does not allow for social distancing, and stress the importance of social distancing even off the job. Suggestions for mandatory alternative protection for tasks when 6-foot spacing is not feasible. Use physical barriers between workers to block face-to-face transmission. Supply and institute mandatory commercially produced face mask policy such as disposable, non-healthcare use masks. If face masks are used, it must be in combination with physical barriers or some other engineering control. Use negative pressure ventilation and employee breathing zones at fixed work locations. Employers are required to ensure frequent and adequate hand washing. Require workers to wash their hands frequently and effectively when they arrive at work, leave their workstations for breaks, use the restroom before and after they eat or drink or use tobacco, and after touching any surface or tool touched by others. Confirm that all workers know the importance of how to wash hands with soap and water for at least 20 seconds, then dry their hands with disposable paper towels and properly dispose of those towels. Portable hand wash stations are required out in the orchards, out in the fields, at any transient work location, and must contain at least warm water, liquid soap, disposable paper towels, and a trash can. Employers are required to increase regular cleaning and sanitizing of common touch surfaces. Establish a housekeeping schedule to address regular, frequent, and periodic cleaning. Provide appropriate and adequate cleaning supplies for scheduled and, when necessary, spot cleaning and cleaning after a suspected or confirmed coronavirus case. Ensure floors, counters, and other surfaces are regularly cleaned with water and soap or other cleaning liquid to prevent buildup of dirt and residues that can harbor contamination. Make sure high-touch surfaces are properly disinfected on a frequent or periodic basis using a bleach solution or other EPA-approved disinfectant. Make sure shared work vehicle interiors are sanitized after each different person's use. Employers must have practices in place that ensure sick workers stay home or remain isolated in housing or go home if they feel or look ill. Note that the main symptom of coronavirus includes fever of 100.4 or higher, cough, shortness of breath, and loss of smell or taste. Other symptoms may include body aches, fatigue, and diarrhea. Develop a process if a worker becomes ill while at work or outside of work, so workers and supervisors know the appropriate actions to take. Develop a process that includes immediate shutdown of areas where the employee was present. Institute deep cleaning and sanitation of all surface areas that worker touched prior to opening that area. Acknowledge the old workplace culture of powering through illness is not appropriate and support the shifting attitudes under this emergency to stay home when sick. Monitor employees, contractors, suppliers, customers, and visitors entering the worksite for symptoms of the disease. Consider testing temperatures or a short questionnaire. Notify coworkers who have come within 6 feet of a worker sick with coronavirus without identifying the sick worker. Inform them of the measures being taken to keep employees safe, like cleaning and sanitizing. Seek and follow local health department and medical authority advice regarding sick employees. Employers are required to provide basic workplace hazard education to workers in the language they understand best about coronavirus and how to prevent transmission. The education must include the signs, symptoms, and risk factors associated with coronavirus illness, how to prevent the spread of coronavirus, including steps being taken in the workplace to establish social distancing, frequent hand washing, and other precautions. Emphasizing the importance of hand washing and how to effectively wash hands with soap and water for at least 20 seconds. Proper respiratory etiquette, including covering coughs and sneezes and not touching eyes, nose, or mouth with unwashed hands or gloves. Emphasize cleaning and sanitizing of frequently touched items, such as cell phones and tools. Other considerations. Employer-provided personal protective equipment may be helpful to further reduce transmission risk amongst healthy and asymptomatic workers. Face shields can prevent direct exposure to sneezes or coughs. They also provide splash protection from cleaning chemicals and disinfectants. Loose-fitting face masks or cloth face covers, like scarves and homemade masks, may be voluntarily worn by workers as a best practice measure to prevent the wearer from transmitting droplets from coughs and sneezes. It's important to understand that these types of face covers do not prevent inhalation of fine aerosols and are not protective in close proximity. If this type of protection is used, it should be washed and disinfected daily. Homemade masks are not an acceptable substitute for social distancing. Thank you for doing your part to slow the spread of COVID-19. Please remember that everyone plays a part in keeping our workplace and community safe. By following the public health recommendations, you are doing your part to stop the spread of COVID-19.